Welcome. Here we are at the procedure room, one of the procedure rooms here at CaloSpa Rejuvenation Center. I have with me once again Dr. Calabrese. Dr. Chet Mays will be doing his thing, and Justine Marks is our, I'm trying to think, is it patient? Is it model? I mean, she looks like a professional model.
It's a model, of course. Yeah, we call them clients, so they're clients.
Okay.
Yes, they're our clients.
Clients and friends probably some of the time. Is that true?
True. Friends and family.
There we go. Friends and family here at CaloSpa Rejuvenation Center. Okay, we have the big injectable event coming up. So what will we see here from Dr. Mays, Dr. Calabrese?
Magic is what I'm going to say. Yeah, exactly. So I think he's planning on doing some Botox and some filler to the lips. I think going to use velour. Yeah. So do you want to explain a little bit then?
So Justine here's had Botox before, and she had some concerns because she's had her brow drop down, which what that means is her eyelids come down, her hair above her eyes, the eyebrow actually comes down. And I told her, I said, well, it depends on where you put the Botox. So today we're going to put it in muscles that actually are pulling her brow down. So what Botox does, it paralyzes the muscles. So all those muscles that are pulling her down, I want to paralyze that so it gives her a little brow lift. So I put her at ease. I said, don't worry, we're not putting in those muscles that are actually lifting your eyebrows. It's the ones that are pulling you down. So that's what I'm going to do here. There's 5 little injections. This is an alcohol wipe here, just wiping off those muscles. And I'll tell you which muscles those are for any anatomy buffs out there, but this one right here, so give me an animation, make an angry face. So this muscle right here is the procerus. I'm going to go right in there because that's what's pulling her down, making her very heavy. So just going to fill this just a little here. There we go.
Well, her brow is heavy. She's not heavy at all.
Right.
Not
for
at
sure.
all.
No, she's a model.
Not at all.
Yeah, I'm sorry.
Yeah.
So we're going to do that motion again. We're going to do 4 more injections. Good. Just come right in here. Good.
And I would think, Dr. Calabrese, important to know the musculature of the face because you're plastic surgeons, Dr. Mays as well. So therefore, to know the musculature of the face, to know exactly where to put that needle.
Yeah, you know, the real issue is that Botox is really about the technique. People will say, well, I had Botox once and it didn't work. Well, the truth is the Botox always works. The Dysport always works. It's just not placed in the right area. So, you know, expertise and how to take an area and make a place elevate and some places drop is technique and know where the muscles are and what you're actually injecting. Because you can put a lot of this Botox in and it actually not last very long or work at all if you haven't placed it into the muscles you need to.
So we're going to take a look at it here. You see these little look like mosquito bites? Those go away within the hour. It's just where the product's very superficial because that muscle is superficial. Now if you raise your forehead, raise it, surprise. I didn't put any Botox here, so that muscle's still going to be fine. She's going to have full elevation of her brow, but these muscles here that were pulling her down have been injected. So within 7 days, those are going to get completely paralyzed. She's going to have a little lift to her brow, and I think she'll be very happy. A little less angry.
So who is a good candidate for Botox? Obviously, we have a very young client patient here. But with that being said, sometimes it's genetics. Some people age differently than others. Or is it an age factor, Doc, that you look at?
You know, it's not really an age factor. You know, I think that, you know, those lines of expression that we see, especially in the upper face, sometimes can have a negative effect. It looks like somebody's frowning or scowling all the time, right? And that can be in a very young person. So you can Botox that in a rather young person, somebody that's in their, you know, 20, in low 20s, who it isn't about aging, it's about the fact that those animation lines are ones that give a negative impression. So if you just do a little Botox, that goes away, and they look happier and they look like they're not frowning. This can be very important if you're like interviewing for jobs or first impressions with people and stuff. So I think it's true. But I would just say Botox works really well in the upper face, crow's feet, forehead, brow. We use fillers in the lower half of the face to do, you know, nasolabial folds, lips, jaw lines, other places like that. And of course, there's a little crossover, but that's generally the rule. If you have problems up, it's Botox. Below, it's usually fillers.
Interesting. So I'm curious, as far as men goes, I know this is, as you mentioned, you know, for job interviews, you want to feel as young as perhaps the people who are your competition, and perhaps you're getting up there a little bit in years. Do men, because of the natural, you know, more muscle in the facial areas, do they need more Botox?
Not necessarily. Every men, women, as far as the amount of units, like Dr. Calabrese said, depends on how much you put in those muscles. Like for myself, for example, I'm in the operating room a lot. I'm looking down, a lot of tension in my forehead. I like the Botox, similar to what I did for Justine here, just to relax that forehead. So when I'm constantly looking down or scowling in the operating room, not in a bad way, but just when I focus, it really relieves some of that tension or tension headaches that you could get. It really helps with that. But as far as men and women, it really, you know, I haven't noticed a difference unless it's, you know, obviously body mass, a little larger muscles, but sometimes men are smaller than women, women are smaller than men, so it just depends on sort of their body mass.
The question, you're going to take a lot. That's what we're saying. That's what you were asking, right?
Bring in the big truck.
But for sure, exactly. I think that of it, for sure. No, so it's dose dependent. So the clinical results of Botox and the duration are both dose dependent. So we try to use the smallest dose we can to get the full effect that somebody wants and that lasts as long as they want it to last. If we don't think it gets the full effect or if it doesn't last long enough, then the next time we do it, we will add a little bit higher dose to it. That way we don't have to go and do these high doses at the beginning. We want to start because it's less expensive and less risk if you just stay with a low dose and then add as we need to.
All right. What kind of feedback do you get from your clients and your patients who come in here? Are they amazed at the results? I mean, you really can erase years, and like you said, it's almost instantaneous.
Right. For someone like Justine, it's more of prevention as far as treatment. Some of our older patients, we're definitely treating some of those lines that have set in over the years. The muscle's been working really hard, and we're relaxing that muscle. But we have patients of all ages who come in very, very happy with the results. And the best thing is when you do a procedure on a patient, they come back for the same procedure down the road or another procedure just because they're very comfortable and like the result that they've had. So that's what we enjoy. There we go. Okay. So what we're using here, this is a hyaluronic acid. It's velour. It's from the Allergan family. We also use Galderma products as well, but I just chose this today because it lasts a year and it's going to do well on her lips. So if you just want to relax your mouth, so when I assess the lips, I'm always looking for any scars or any injuries. And she actually has a little scar right here from her previous cat bite. So that's something I'm going to build into this because it's going to be a little tougher when I inject. And then when I look at her, as far as her lips, I asked her before we went on air sort of what the look that she was going for. She just wants a little more global volume, a little more in her upper lip versus the lower lip. And we're going to try and bring the lip down with our injection just so we have a little less tooth show, or incisor show is what it's called. So that's what we talked about beforehand. So I'm going to start that injection now. I'm not going to get it done probably if there's only 30 seconds left.
We'll take a little bit more time. Take your time. Yeah, we can take a little bit more time.
So what I do is I'm just going to line her lips.
I like to pressure him like that. So don't take that away from him. But the injections are actually really pretty quick. It's only 1 cc. So people come in and think it's going to be a long, arduous process, and generally it's not. You can very quickly, and often for patients, we'll do 3, 4, and 5 syringes if we're doing global facial rejuvenation. So, and we'll do it pretty quickly in just a few minutes. So,
what is the patient feeling now?
Usually a little.
I'm numb.
So she had numbing cream. She sat with numbing cream for 30 minutes, so she's very, very comfortable. As you can see, just relax your mouth.
One thing while he's injecting here that's important is these days here at CaloSpa, we have something called a Pronox. So for those patients who are fearful, just like the people that are fearful going to the dentist, we have nitrous oxide, so we have the ability to take the edge off of that anxiety and make it much more comfortable. For those patients who desire something to help them out, we thought it was very important to provide that. No need to have somebody come in and worry about it or feel like they're coming in and have to suffer. We can make it very, very easy for them. So like you said, often numbing medicine works really well. But if they need more and they know they're scared, we have Pronox to help them with that.
Okay, once again, another reason to come to CaloSpa Rejuvenation Center. You can see, instantaneous results. Yeah.
So you can see some of the fullness, and this product will absorb some water over the next 24 hours, so I have a little more plumpness, but I haven't done anything to this right side. I just want to put it into the left side here so you can see the difference where it's brought down over the teeth there a little more, and then if you smile, you're going to see a few little bumps. That's where the actual needle goes in, maybe a little bruising, a little swelling, but thank goodness no major bruising on air, so I think we survived on this side with no bruising, so it's very, very nice. I'm going to do the other side next, and then the lower lip as well.
All right, well, we'll do that off camera, but before we go to break here real quick, I want to remind folks about your injectable event. If you're interested in having one of these fillers, Botox, then that event is important because you can save some money.
Yeah. So it's March 22nd. It's that evening event. It's from 5 to 7 o'clock. You just need to call 814-3000, which is our spa, and make a reservation to be at that event. But if you can't come that day because you're out of town or it's inconvenient, then during that day at any point in time you can call and you can order from one of those specials. And like I said, we have a lot of different specials, but most of these Botox and the fillers that we use are all on discount during that time, saving somewhere between $300 and $700 based upon what product it is. So it's a really great way to save, get you ready for Derby, get you ready for summer. Most of these products, like in this lips, last a year. So what you're doing now is going to last a long time.
All right, once again, we'd like to thank Justine Marks, our model, of course, Dr. Mays and Dr. Calabrese. Again, CaloSpa Rejuvenation Center. Call today and get ready for the injectable event. We'll be right back, coming to you from CaloSpa.